Good evening, everyone, and welcome to the annual Louis L. Odette Family Lecture. I'm going to stand a little bit further back from the mic. So my name is Stephen Huang. I'm a physician and research scientist and the director of MAP Center for Urban Health Solutions at St. Michael's Hospital. So I'm going to be your moderator for this evening. So this distinguished lecture series began back in 2015 when the Odette family gave us the opportunity to host an annual lecture that shares groundbreaking ideas and innovations from leading experts in the field of homelessness research and practice. So unique in North America, this lecture gives us a powerful platform for the public to engage in and discuss meaningful solutions to a crisis that affects us all. It really is a crisis. The statistics are alarming. We know that every night in the city of Toronto, more than 12,000 people are in our shelter system. We have members of our community living on the street, in encampments and in parks. And these individuals have much poorer health than the general population. They die at a much earlier age and have very short life expectancies. So the focus of tonight is how we address this challenge for our city with compassion, but also with pragmatism and with the humility to learn from other cities and their practices. So tonight, our keynote speaker is Mandy Chapman Semple, who's going to share learnings from her work as a longtime practitioner and designer of homelessness response systems in Houston and other major US cities. So we're going to discuss how Mandy's learnings and experiences in the US could be applied here in Toronto. And I just want to thank our panelists here tonight, Toronto City Councillor Chris Moise and Gordon Tanner, the Director of the City of Toronto's Shelter and Support Services, for joining us tonight. So before we proceed, I want to acknowledge that the land that we live and work on, Toronto, is part of the Dish with One Spoon covenant territory and is the traditional and ancestral lands of many nations, including the Mississaugas of the Credit, the Anishinaabeg, the Haudenosaunee, the Chippewa, and the Wendat nations. It's land that's part of Treaty 13, signed with the Mississaugas of the Credit in 1787, also known as the Toronto Purchase, which was revisited in 1805 and 2010. Toronto is still the home of many diverse First Nation, Inuit, and Métis peoples, and by acknowledging the land, we acknowledge our treaty responsibilities in sharing this land, and to the Indigenous people who have been the traditional caretakers of this land since time immemorial. So thank you for joining us here in person at the YWCA Toronto, and also those of you who are joining online. And now I'd like to invite Dr. Tim Rutledge, the President and CEO of Unity Health Toronto, of which St. Michael's Hospital is a part, to come to the podium.
Well, thank you so much, Stephen, and thank you so much, all of you, for being here. It's great. We have nearly 200 people here in person, and welcome also to those of us who are joining us virtually, nearly 200 people joining us virtually as well. Welcome to the 2024 Louis L. Odette Family Lecture. And of course, I know that I'm preaching to the choir when I say this is such an important topic, and I'm so glad that you're here to join with us to discuss these issues. On any given day, about 40,000 people in Canada and more than 12,000 people in Toronto experience homelessness. Unhoused people can be young, or they can be older adults. They can be people escaping intimate partner violence, or they can be refugees or new immigrants, or people evicted when they can't afford their rent payments. They could also be people living with chronic illnesses that prevent them from working. The number of people experiencing homelessness in Toronto has grown dramatically over the past few years. So too has the number of people considered chronically homeless, that is, people who are without a home for more than 6 months. At St. Mike's, we see this crisis play out every day in our emergency department, and throughout the hospital. In fact, the St. Mike's Emergency Department cares for more people experiencing homelessness than any other hospital in the city, and probably in the province. We also provide research-based social and health programs within and outside our walls that are tailored to the unhoused patients and connect them to the care and supports they need. St. Mike's medical care and research are shaped by a strong commitment to health equity. We strive to make sure all of the members of society, including those who are most vulnerable, receive quality health care, and we do our best to help them achieve good health. Much of our research on homelessness and health is led by Dr. Stephen Wong and his fantastic team at St. Mike's world-leading MAP Centre for Urban Health Solutions. MAP is Canada's largest research centre that's focused on health equity and the social determinants of health. We are so fortunate to have Dr. Wong with us today as our moderator. Thank you, Stephen. He is one of the world's most renowned researchers in homelessness, housing, and health. He has led studies on chronic homelessness and its impact on health and life expectancy, and he has evaluated concrete, practical solutions to address homelessness and health, including an approach known as Housing First, which we're going to hear more about this evening. Dr. Wong's work has changed the conversation about homelessness and precarious housing in Canada and raised awareness that these critical health crises are preventable. Homelessness has a terrible impact on health, but homelessness cannot be solved by one sector alone. It is a multifaceted social issue that requires multifaceted responses. And that's why this evening's talk and this environment that we're in this evening is so important. It matters so much. Every year, the Lewis L. Odette Family Lecture provides us a forum to come together across sectors to learn from others and rethink Toronto's approach to homelessness. On behalf of Unity Health Toronto, I want to express our sincere thanks to the P&L Odette Charitable Foundation for your long-standing contribution to our work to end homelessness. And thank you, Lou, so much for helping to shape this evening's event and for being here with us this evening. I appreciate that we can approach this discussion with some common core principles: that everyone should have a safe place to live, that living in a temporary shelter is not a long-term solution, and that living rough outside is not acceptable in Canada. I'm really looking forward to this evening's discussions, and with that, I will hand it back over to Dr. Wong. Thank you.
Thank you, Tim. So it's now my pleasure to introduce our special guest tonight, Mandy Chapman Semple. So Mandy is a longtime practitioner and innovator and designer of homelessness response systems. She's recognized internationally for the work that she's done in Houston, Dallas, New Orleans, and numerous other U.S. cities. So her work to begin to transform the responses of the system to homelessness began back in 2012 in Houston, Texas, when she was named the special assistant to the mayor of Houston for homeless initiatives. Before then, she gained practical experience in running a public shelter, working as a supportive housing consultant, and also engaging as a senior leader in philanthropy. So today, Mandy is the managing partner of Clutch Consulting Group, an organization that she co-founded in 2018 to help communities redevelop social service systems for their most vulnerable residents. So Mandy has traveled here from Texas to be with us here tonight. Please join me in welcoming her as our keynote speaker for the 2024 Lewis L. Odette Family Lecture.
Thank you so much for having me. It's really a true pleasure to be here. Thank you, Dr. Wong, for that very warm welcome. And thank you, Lou Odette and the Odette family for inviting me here to share my story and the insights that I have in building a system to end homelessness. To give this topic such a platform, such a distinguished platform, is really important and really a testament to the incredible leadership that you show on this issue. Thank you. I also really want to acknowledge the St. Michael's Foundation and St. Michael's Hospital. It's from the very beginning, when we've been engaging in all of the prep for today's event, it's been evident that the long history, right, that exists within that hospital shines through in everything that you do. That health equity and that health and well-being of everyone is central to what you're doing. And that's a shared value of mine. And I'm just deeply fortunate to be here among all of you and to be speaking kind of on behalf of those values. I'm really delighted also that you all have chosen to spend your evening with us. I think we're going to be able to offer you some real insights into this topic, into a topic that can feel very daunting, sometimes overwhelming, maybe even hopeless. And I can tell you that I too have those same feelings, even though I've experienced how solvable this issue is, even though I have been through the fire and come out the other side and have seen the results that we can get. Some days I still ride that same roller coaster. And so what I'm encouraging you, what I'm inviting you to do today is come into the discussion tonight and let that skepticism kind of give way to curiosity. Lean into possibilities on what we can do on this particular topic, and like let those constraints become part of what motivates us to reimagine, right, how we can respond to this. I encourage you to think about how to become a thoughtful disruptor in this space, because that's what it's going to take to solve complex social issues. I think it was said earlier, it's not just one sector that can make moves on this issue. It's going to take the whole village. And that ripple, that wave, right, of thoughtful disruption can start in the room today. So I encourage you and look forward to checking in with you later in the evening to see if we've been able to accomplish, some of that hope and some of that inspiration that I think we all need. So let's begin. My story starts in Manhattan, Kansas, which is not really probably much to talk about. But what this really is a story of an unintentional career commitment to solving homelessness, not something I necessarily expected to do. I was an undergrad at Kansas State University, and like many undergrads, I needed a job to earn some extra cash. And I was pursuing a degree in microbiology at the time, working in labs, but I still had evenings available. And so they were hiring at the local emergency shelter for folks, overnight staff. And this seemed like a great fit for someone like me who had lots of homework, who really liked talking to people, and they were going to pay me to sleep. It felt like a good fit. And so I took the job. And, while I was certainly inspired to help and to support vulnerable individuals, not necessarily the career that I thought I would end up in. I thought that I would definitely end up in medicine and research and helping individuals in that way. But what happened is I became increasingly connected to the individuals and to this issue in particular. And the reason I became connected is that I saw a homeless service sector that largely approached the solution to homelessness through the lens of charity and not necessarily through the pursuit of remedy. And so it was that background in science that afforded me the opportunity to see it differently. And I was really intrigued at the opportunity to apply some of those same kinds of critical thinking skills, but in an environment where I can have an immediate impact. Don't get me wrong, it is great to be in the lab, mapping the genome of the red flower beetle and trying to find the protein so we can develop a treatment, against a parasite. But I felt like I could have a more immediate impact in this sector, in this field. And so that's what I elected to do. This was further confirmed in my first job interview coming out of out of graduate school, when they kept asking me about my qualifications and I kept talking about the interpersonal skills I developed at the emergency shelter when I was an overnight worker. And that really solidified for me that that was the path that I needed to pursue. And it took me a little while, but I eventually got there. What happened is I found my way back to that exact same shelter as an executive director. And this began my journey to experiment within that sector to find the remedy to this particular issue. Because the thing I knew running that emergency shelter is that emergency shelter alone was not going to cut it. It wasn't going to be the answer. So what evolved from there is this understanding of who I am and who I am today for all of you. And that is I'm a strategist. I'm a problem solver. And I think many individuals who pursue this sector and pursue this career really come at this with the values and the principles of social justice and housing justice. And while those are important to me, those are not actually the things that drive me. What drives me is that this is a problem that needs to be solved, and I want to solve it. And if I solve it, I can honor those values. But not being constrained by that strict adherence to those values. And I think this is something that happens so often to individuals who really are staunch advocates for those values, is that those things can become quite paralyzing. And all of the sudden, kind of perfection becomes the enemy of the good. And so I'm, if nothing else, if not candid. And so the honest answer is I'm here today to be very practical and to hold those values, but to be very sensible in how we actually move all of the pieces so that we can honor those values and do right by the individuals in front of us and by the individuals who may be suffering in the future. So my story of Houston is really one of capitalizing on incredible opportunities because I was able to challenge the status quo. Right? I was able to not be so wed to the pursuit of an ideal that I could simply look at what was in front of us and start to force a reimagining, right? Start to question why what we were doing, why the experiment that we were performing wasn't getting us to the answer that we were looking for. And perhaps to start experimenting with some other ways of doing things. And that was the start. So everything I've done since then, every community I'm going to share and talk about today, it's those same principles that we apply in the pursuit of a solution to this issue. Okay, so here's how the journey begins. It starts with how I figured out why we need to reimagine homelessness response. When I stepped back and really examined the issue of homelessness in today's society, there were some simple truths that emerged for me. First, the current approach is not enough. Our emergency shelter system was built for a different time. Our emergency shelter system was built for a time when housing was affordable, when all someone needed was a place to land to have their basic needs met for a very short period of time so they could bounce back into that community, into our society. And given that those are no longer the conditions, the second truth is that shifting conditions require a shift in strategies. That hanging on to the old way of doing business is not going to get us to the remedy that we're looking for. Housing first. This idea of moving individuals directly into housing and providing them with the supports that they need to stabilize, that is one of those shifts in strategy. And I'm so proud to say that so many countries, including the United States and Canada and Europe and Australia, have embraced these principles of housing first. But unfortunately, we have not fully shifted our homeless response systems to represent housing first, right? In all of its principles. What we've done is we've added housing first as a strategy, but maintained an old system, an old way of doing business. The third truth is that emergency response and rehousing interventions, those real solutions to homelessness, they seem to be in competition. And that if we want to remedy this, we were going to need to recalibrate, and that those two things could no longer be in competition, but needed to work in concert. I liken it to if we walked into a hospital and the hospital couldn't offer us treatment, but was willing to offer us a waiting room. We wouldn't be very satisfied. We would demand that that hospital figure out how to treat us. But what we've been doing in homeless response is we've just been adding more waiting rooms. We're stuck in this cycle, right, of thinking that that's the only thing that we can make available, and certainly the only thing at scale. And so what it really affords us is the opportunity to reimagine. The answer lies in reimagining it all. So, what I was able to do is understand all of the different parts of a homeless response system and think about how all of those different parts work together and understand why what we were doing was creating the path that we were on. And I could begin to imagine how we could rearrange those pieces. We could move those pieces around, connect them differently in order to get a different result. And so I want to show you some animation here that I hope will help illustrate this more concretely. So here is what our instinct has been. Our instinct has been, we need to grow a big funnel in order to catch people who are in crisis. Right? That's our emergency shelter system. And our response to a growing number of people in crisis, our instinct is to want to grow that funnel. The problem is that we're not necessarily increasing the number of exits out of that funnel. So no more people are getting out than were getting out before, but we keep growing a bigger and bigger funnel to catch more and more people. So what ultimately happens is that these long stairs in our system ultimately grow, right? Those long stairs grow over time because on an annual basis, more and more individuals are coming in to our system. And so when our long stairs grow, if we don't keep growing our funnel, what ends up happening is individuals spill out of that funnel and end up sleeping rough on our streets. So this for me was an easy way to begin to understand what was happening in our system. Why was what we were doing not working, not getting us to where we needed to be? So what I came to understand, what the data revealed to us, is that we actually need to invert the funnel. And that there were a few other things that we could do. So first, we could actually shrink the number of people that needed to come into the funnel altogether by helping more people avoid entry into homelessness. Right? Then, if we grew our funnel representing rehousing solutions for individuals, that we could eventually shrink those long stairs, and over time, we could ultimately eliminate them. And when we did that, we could then recalibrate our funnel back to meet the exact demand, right, that's coming into our system. This is something we like to call equilibrium. So this set a roadmap for me. I said, what we need to do is invert the funnel. That's what it's all about, inverting that funnel. So now we have a new focus, building an emergency rehousing system. As we build that emergency rehousing system, we need to consider that all paths must lead to housing as quickly as possible. That might mean avoiding shelter altogether, like we talked about for individuals who we can help avoid coming in, but it also might mean if you're sleeping outside, we take you directly to housing. We don't need to make a stop at shelter unnecessarily. It could also mean that when individuals come to our front door and they have a plan, they know what they need, we simply support them in self-determining what they need and moving out of that crisis far more immediately than what our shelter system is necessarily designed to accomplish today. The point of this new emergency rehousing system is to reduce harm. So the more that we can limit the time of individuals inside shelter, the more that we can inspire hope among all of these individuals who are in crisis, the better outcomes these individuals are going to have, and the overall health of our community is going to be enhanced. So there were a few additional inputs that I needed to understand and test before I could really definitively shape a strategy. So the first is really investigating and understanding what happens inside emergency shelters. Like, what are emergency shelters designed to do? And are those investments getting us what we wanted? And ultimately what I found, having run an emergency shelter myself, is that those emergency shelters are really smart investments when each bed can serve lots of people in a year. But all of the sudden, when those emergency shelter beds or a bed is only serving 1 or 2 individuals a year, that becomes a very expensive temporary intervention. And in fact, when you start to compare the data, it's much cheaper to actually pay for someone to live, pay their rent for them to live for 12 months in an apartment and support them in that apartment than it is to pay for that emergency shelter bed. The other thing that I learned is that it's far healthier for the individual. Right? There's a lot of trauma that goes into an emergency shelter visit, in large part because you lose your ability to self-determine. And so in many ways, we are breaking the spirit of individuals, when in fact, what we want is a system that inspires individuals to reconnect with our community and to self-determine and to find, right, a path that leads to their own health and well-being. And we want to support them in that process. We want to build systems that support individuals in doing that. So the concept of an emergency rehousing system is this. It doesn't mean that we don't need emergency shelter or that emergency shelter is bad, right? What it means is we need to make emergency shelter work the way we originally intended it to work. Right? It needs to serve many people in a bed over the course of a year. And so in order to do that, we have to grow the exits out of our emergency shelter. We have to, when you come into an emergency shelter bed, that has to immediately lead to a rehousing solution so that we can bring the next person into that bed, and that can immediately lead to a rehousing solution. So an emergency rehousing system isn't wed to just emergency shelter or just rehousing interventions, right, as a pathway, but simply embraces this concept that rehousing can be the response to the emergency. And we need to build systems creatively that do that, just that. So with all of that in mind, with all of those things, right, that I explored, what it positioned me to do was join Houston, to move from Kansas to Houston, and really be afforded an incredible opportunity. You know, as Dr. Wong said, I was able to move into the mayor's office, and I was given permission to reimagine homelessness response based on these principles that I've described to you, based on this notion that we were going to build an emergency rehousing system, because rehousing was the real remedy that every individual experiencing homelessness needs. Now, it doesn't necessarily mean that it's a one-size-fits-all solution, right? Individuals are going to need a tailored package of supports in order to stabilize in housing, but we can build that. But what it meant is at the core, we needed to make everything point to rehousing, either by avoiding entry, by staying in housing, or by getting out of homelessness as quickly as possible by being afforded a rehousing solution. And then we can tailor all of the supports that we need around those individuals in that process. What was so incredible about the experience in Houston is that we were serving a population of about 7 million people. So this was a big system. At the time, there were about 8,500 individuals experiencing homelessness on any given night, and over half of them were living rough, living unsheltered. And that's because we didn't have a shelter system that was publicly funded, and to this day still do not in Houston. And so we were faced with an incredible task, right? A choice. We could either invest in building out an emergency shelter system to meet all of that demand, or we could invert the funnel. And we could invest in assembling those rehousing solutions and going directly to the individuals living on the streets and moving them into housing, and moving the individuals in shelter into housing, and activating that entire system to become a rehousing machine, because that's really what we needed ultimately. And the results were really incredible. In the first 4 years of this initiative, we reduced homelessness by 60% in Houston, and about 70% reduction in unsheltered homelessness, because this was obviously a primary target for us. And we've been able to sustain it for nearly a decade now, despite a major hurricane, despite the pandemic. And the reason we were able to do that is because of the mindset that we embraced. So I did all of the work to figure it out, but what I presented to this Houston community was not, it's this, here's the remedy. It's not necessarily shelter, it's this other thing. I didn't present that. What I presented is we need to think differently, and we need to hold ourselves to building an emergency rehousing system. And it doesn't mean that we're not going to have to kind of twist and turn and pivot along the way in order to get there, but we have to hold that vision. And everything we do has to be incrementally contributing to building and scaling a rehousing system. And if we do that, then we're going to be able to see incredible results. And that has been the steadfast commitment of the Houston community for now almost 15 years. And that's what's allowing them to continue in this pursuit. And it is such incredible work that they're actually nearing equilibrium, which is an incredible feat. So I think oftentimes everyone wants to know, well, how did Houston do it? And I'm going to give you the steps. But I want to reiterate that it was the mindset more than the steps themselves that was really the difference maker in all of this. If we can hold this vision of rehousing, then we can adjust the steps to meet any local condition. And that's really been, in large part, my pursuit, not just in Houston, but in cities across the country. So let's walk through the steps. The first is that we had to embrace collective impact. Collective impact is one of those things that's thrown around quite a bit on lots of large social issues, but I want to be really explicit in what it means in this context. We literally had to unite the public and private sectors. That we had to understand that this was going to take the whole village, and the village had to come together and align around a shared vision, a shared set of values and principles of what we were in pursuit of together. And it was by coming together that we were all granted the permission to hold that vision and to pursue it, right, as a collective. We also had to accept that there was no hard power in any of this. I don't know how many times I go to a community and, I hear, well, we can't do it because we're not in charge. We can't do it because we don't control the resources. There is no city in the world that I'm aware of where all concentrated power, all power is concentrated with one entity who controls all things homelessness response. And the reason that doesn't exist is for the reason that was articulated. It's a multifaceted issue that requires multiple sectors to align and come together. So we had to accept that there was only going to be soft power, but there was actual hard power embedded within it, right? Each sphere of influence has hard power over its own resources, has influence over its own constituents. And if we collected those spheres of influence and brought them together under this collective, that soft power would give us the permission and empowerment that we needed to pursue alignment in every sector that we needed to come together. The other piece of this is really embracing this notion of intentionality and standardization. So remember when I said what I saw at the very beginning of my journey was a homeless response sector that largely approached this issue through the lens of charity? The consequence of that is that we have approached this issue by allowing individual organizations to propose different programming and sell it as if it's going to provide the solution, but without any regard for what the next organization is doing. So nobody's looking at the whole and saying, how do we put all the pieces together so that we can create the overall remedy and result for everyone experiencing homelessness, not just the person who happened to walk into this organization or that organization. And that was a really big shift for us at the time, which is why that collective of governance, that center of gravity, was so important, because all of the funders needed to align to this idea that we were going to ask providers to change the way they did business. We were going to ask providers to find how they could best contribute, and we were going to ask them to grow in those ways. We were also going to ask them to stop doing some things that they had been accustomed to doing. But in order to do that, the money had to align. And so we needed to drive some standardization so that we could align those resources. And we had to be very intentional in how we did that. And we did that with the providers themselves. We established a collective impact structure that brought the providers into that space and challenged the providers to help drive the solutions and drive the standardization and to be intentional together, right? Not in competition with one another. That's a really big distinguishing factor in all of this. The last thing that we did is we really conditioned the field to systems thinking. And what that ultimately means is that we were going to see the homeless response sector as a series of components, and that we were going to connect those components together to produce a pattern of behavior. So you have that now. You operate as a system, right? Your primary component is emergency shelter, and it's connected to some rehousing exits, but not enough. And so you get the result, right? You get the pattern of behavior that system design is supporting. And so by embracing that, by conditioning everyone to accept that, what it meant is we could change it. If we weren't getting the result we wanted, then we could rearrange the parts, or we could infuse more components and connect those components in a particular way. So this way of organizing was really about empowering groups to come together, right? To conceive, to act, to evaluate, and to adjust in real time. That was the other piece of this, is that we needed to operate as if we were experimenting. This idea that we could quickly determine whether what we had come up with was going to work was a really important part of coming together, right? Of that collective acting together. But it also insulated everyone, right, from feeling vulnerable that they weren't getting the outcomes or weren't getting the results or potentially weren't getting the funding. The whole point here was we were being funded like scientists in pursuit of the remedy. Just, I don't know if you've ever worked in a science lab, but most days you fail, right? But I don't think anyone would describe it that way. What they would say is they hadn't figured it out yet, right? That we needed to adjust a variable in our experiment. We needed to tinker. We needed to pursue a new hypothesis. So we wanted to apply those same principles in this context. So that's what collective impact afforded us, is the ability to actually come together and think like that and act like that. It's a real difference maker. The last thing that we were able to do was really embrace feedback loops. So we were looking at both quantitative and qualitative data to provide us with the insights, but we weren't necessarily waiting for a years-long study to give us that answer. We weren't going to tolerate. It was more like 7 days at a time, right? Like we were going to figure things out in real time, and that we were going to continue to monitor those feedback loops. And if something was out of whack, then we were going to make an adjustment. The next thing we did is we let constraints activate our design adjustments. This is one of my favorite parts of this work, because it means there's no obstacle, no mountain too high, right? Not enough shelter beds? Fine, we'll skip shelter. We'll go right to housing. Not enough housing subsidies? Fine, we'll recalibrate the resources we have to make them stretch across a larger swath of individuals. We'll test the limits, right? So that we can serve more people. When it was difficult to find units, we said, no problem. We'll assemble a dedicated team of landlord engagement specialists. We'll give them a pot of money and we'll let them go buy our way into the market. We'll let them go strike business deals with properties so that the individuals who are exiting homelessness have access to units. When encampments started to grow pretty substantially during the pandemic, we didn't just move folks into shelter. We went right to those encampments and started rehousing whole encampments and decommissioning because we didn't want anyone to sleep outside. But we knew that if we moved them into an emergency shelter, we wouldn't then have the resources to house them. So we said, skip shelter, move them into housing. So I don't want to pretend that each of these decisions is necessarily the right decision for every community. Again, I want to reiterate, this is a way of thinking. We let the constraints activate our design adjustments. We didn't let those constraints paralyze us. We didn't say, well, there's not enough affordable housing. I guess there's just nothing we can do. We said, oh, we'll figure it out. But we're going to keep housing people every day because that's the vision. Finally, we push boundaries, surprise, 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 and change the narrative. We really had permission to experiment and learn. And so that made us bold, audacious even. You know, we set goals early on, things like we're going to house 100 people in 100 days. Having no experience really in rehousing anyone, but we were like, we're going to muscle our way through that and figure it out. And then we said, once we accomplished that, we said, hey, what if we house 300 people in 100 days? Right? Like we pushed, right, the limits of our system so that we could learn and grow and scale, because scale was the promised land. We celebrated the increments. Some days we don't have enough resource to get all the way, but that's okay, right? What we did is we figured out how far we could get with what we had, and we pushed it as hard and as fast as we could, because we knew that if we can get there and we could demonstrate that success, it was going to be a lot easier to get more. I'll tell you, it's really difficult if we're not doing anything and just saying there's a really big problem and that problem is growing. It's really difficult to get people to invest in what you're doing. It's so much easier to get people to invest in the solution. And especially when you're demonstrating incredible results, because people become hungry for more. And it's a lot easier to say, we need to sustain our gains. Don't let us go backwards. Keep investing, keep building, keep scaling. We seized every opportunity that was available to us. So this kind of goes back to that scrappiness that we employed here. So there's so many things to unpack about Texas and about Houston when it comes to public funding. They don't really collect a lot of taxes in Texas. And so there's really not a lot of public funding available to us. We were primarily using federal resources that are allocated for homeless response. And absolutely no general revenue from the city, even to this day, goes into homeless response. So we had to seize every opportunity that was available to us. And so, for example, when the pandemic happened and there was a huge infusion of resources, we grabbed those resources to scale our rehousing activities. When the hurricane hit, we convinced FEMA to use the resources not to shelter people, but to rehouse people, right? And we pushed the boundaries in each of those instances. Now, those were not necessarily permanent dollars, right? And we're still in the cycle of having to go and find sustainable funding behind all of these things. But again, as we build that system, it's a lot easier to ask people to invest to sustain than it is to, invest in a system that has failed. So those seizing opportunities were incredibly important, and I have lots and lots of examples of grabbing at any one-time money that you can find in order to move an increment, right, toward that goal. The other thing we did is really created simple, honest, and active communications. Because here's the reality, is that on a daily basis, the public is measuring our success based on their own experiences, right? So if they walk by someone experiencing homelessness and they've been walking by that same person who's been on that same corner, no matter how much we tell them we're doing a good job, it doesn't feel that way to them, which means we really have to tell them every day that we're doing a good job. that we're making progress and that we haven't got to that corner yet, but we're going to. So figuring out how to communicate more plainly about our progress was really important. And how we drilled that down ultimately is if our aim was to rehouse more and more and more people, then that's what we were going to be accountable to sharing. That last week, right, we were at 200, and now this week we're at 225. And next week we're at 300. And we just continue to grow that cumulative number, because what it does is it shows that we're accountable for continuing to make progress. Because what I found is that while the public can get quite frustrated on this issue, and they do seem to really demand results or, change very rapidly, they're actually quite tolerant as long as they know we're working on it. And as long as we can show that we're making progress and we have a vision to get all the way. That's really important. And so that became a really central part of what we did in Houston. So from there, I was like, this is great. 60% reduction in homelessness. This feels really good. But immediately, folks around the country in the United States said, well, there's all these reasons why that worked in Houston, right? And why it won't work anywhere else. And I just wasn't convinced of that. But like a good scientist, I was like, well, let's go experiment. Let's go try. And so we went out and started supporting other communities, looking for communities who are equally as interested, right, in the playbook. And so there is really a formula or a playbook here. It doesn't mean that it can just, be applied. It has to be adapted to the unique conditions of any community. So let's talk about each of these communities a little bit. Oklahoma City is a mid-sized community, and it has a substantially or a surprisingly large unsheltered population for the size of its community. And what we discovered is that unsheltered population was largely chronically homeless individuals. So what it meant was the shelter system was not able to serve those individuals. Those individuals were just no longer pursuing the shelter system because there was no remedy for them there. And so they were like, I'm pretty accustomed. At this point, if this is my life, I'm going to go live in a tent and have some self-determination. I'm going to figure some things out. And so we developed a strategy there to start this playbook directly within those encampments. And so in 1 year, they've housed 306 individuals directly from the streets into housing and closed 20 encampments permanently in this community, just over half of the encampments in their community. And the goal is to get to 500 in 2 years. So they have one more year left. And the whole point of this was to begin to build those rehousing muscles, right? To equip their system to be able to rehouse everyone, because this isn't going to be enough, right? They're making incredible progress, but we still have to go back and make that shelter system an effective connection to rehousing solutions for this to be the long-term. But this was the first increment, right? It established a proof point in the community that housing first, and that rehousing can be an emergency solution. It can provide relief and remedy to the individuals experiencing homelessness and to the community who's experiencing that street homelessness in the same way in many regards. So we needed to start there because that's how we were going to build the bandwagon in Oklahoma City. Dallas was a different story. Dallas they were on a trajectory of growing unsheltered homelessness, well over 2,000 individuals sleeping outside on any given night and growing. They really didn't have a rehousing system. When I got there, they were honestly rehousing about 20 individuals a month out of the entire homeless response system, which was tough, right? No wonder they had growing unsheltered homelessness. And so we seized opportunities during the pandemic and set a goal to rehouse 2,700 individuals in 2 years. This was audacious, but they did it. Part of it was because those one-time resources were available to make it happen, but I can tell you there's no going back now. There's no way that community is going to not find the resources to sustain that capacity. To go from rehousing 200 or 20 people a month to over 200 people a month, it's a game changer. As a result of that, Dallas has seen a 24% reduction in unsheltered homelessness since 2021 and a 19% reduction in overall homelessness. So they reversed their trajectory completely in just 3 years as a result of that effort. New Orleans is another great example of a community that was really challenged. New Orleans has lots of hurricanes and actually has a relatively small unsheltered population, but had been through a cycle repeatedly where they literally moved everyone off the streets and rehoused them, and then the streets would repopulate, which really was a signal that the rest of the system wasn't working very well. But we needed to start in the same place that they had always started. We needed to start by eliminating street homelessness, if at all possible. And so we started with a major initiative, and it's fully underway now, to rehouse 1,500 individuals in 2 years, targeting all of the encampments in the inner core, and then equally activating their shelter system to become a rehousing system so that they sustain their gains, right? So they've now committed to not going back. It is not an easy ride. If you Google New Orleans, you'll see all sorts of interesting things that have happened in the last couple of weeks there. So it's not to say these things are easy, but the pursuit of it has real impact. In 1 year, in the first year of their initiative, they reduced unsheltered homelessness, street homelessness by 12%, right? And it was really just a few months of activity in that first year. So it really can have a pretty dramatic impact. The stories in Denver and Los Angeles are a little bit different. These are communities that were suffering from significant unsheltered homelessness. Los Angeles is on a scale unto itself. But Denver was kind of chasing in terms of the amount of growth in unsheltered homelessness. And a new mayor came in and said, enough. And they went and leased a whole bunch of motels and moved 1,000 people off the streets into these motels in 6 months. Pretty incredible. Except they had no rehousing muscles built, no rehousing capacity whatsoever. And so they found themselves in a real tough spot because now they've created an expectation, but they couldn't kind of continue, and they were spending tons of money on emergency shelter. And it was difficult to find the money now for the rehousing, but they have. And so they've put a new plan in place where they're now starting to rehouse everyone out of those motels. And the goal is to yes, backfill some of those motels for a period of time, but the goal is to get rid of those motels over the course of a couple of years so that all of those resources can then be dedicated to equipping the system to be a rehousing system. Right? You see the pattern? Los Angeles did the same thing, moved a lot of people into motels, and then realized they needed to start figuring out how to get them out. And Los Angeles is an incredibly tight housing market, probably pretty similar to what you're experiencing here in Toronto. And so, believe it or not, they have been able to find units. They had to use some very interesting techniques to do it. Some of those techniques actually involve master leasing entire apartment complexes. What's really interesting is they're newly developed apartment complexes even. And they were just afforded the opportunity to go after the developer developed and said, hey, we'd like to lease the whole thing. And we'd like to make a business arrangement with you to do that, in addition to, a more scattered site, tenant-based strategy. So I offer you this. If a place like Los Angeles, who has 70,000 people experiencing homelessness on any given night, right, over that, and they have seen double-digit increases year over year, if by employing these same concepts of rehousing, they have been able to stop that growth, and in fact, they saw a 0.3% reduction last year. We're all celebrating the increment. But they saw a 5% reduction in unsheltered homelessness. So they're on the right path, right? But if they don't stay committed to that, they won't be able to sustain those gains. So they have to continue to fully shift that system if they want to accomplish this. But what it showed for me, ultimately, is that this works in other places. That embracing this mindset, even though it equally can feel overwhelming, right? This idea of having to pivot an entire system. Where do we start, right? The reality is there is a place to start. And it doesn't all have to be all at once. It doesn't have to be a huge grand gesture. What it does have to do is it has to have a center of gravity. It has to have public-private partnership that can form a collective. It has to have a shared vision. And it has to have a quarterback or a backbone that can support moving all of the pieces and keeping everybody on track. Because as you can imagine, when you're asking lots of sectors to come and prioritize this issue, it can be very easy for those sectors to lose sight of that because they have all sorts of other responsibilities. So having someone holding that vision and keeping everyone in alignment and communicating the progress and creating the bandwagon, that's how we get to the incredible success. That's how I got here tonight. I got here tonight because the New York Times was able to lead with a headline a couple of years ago that said, Houston's housed 25,000 people. Because that's the simple messaging that we developed. That's the way we created the bandwagon. And I'm standing here today telling you we've housed over 30,000 people. And counting. We're on our way to a system of equilibrium. We still have plenty of obstacles and challenges ahead of us. There's still 1,000 people sleeping outside on any given night in Houston, but we have a plan and we have a shared vision and a shared value to eliminate street homelessness and to fully pivot our system to rehousing. So I started small. I started in Manhattan, Kansas at a 26-bed emergency shelter, working overnights. And what I hope I've been able to accomplish for you today is that I can really represent a lighthouse for you. I can be a beacon that helps you through this storm. And that there is hope. This is solvable. Heck, it's solvable in a decade if we really wanted it to be. And I'm not saying, count on that. But what I'm saying is if we don't start to pursue it, it will never happen. So follow the light. Thank you.
Thank you so much, Mandy, for that inspiring talk. We have 30 minutes now for a panel discussion, and so in order to allow for a really fulsome discussion, what I'm going to do now is invite our panelists to come up. So Councillor Chris Moise, thank you very much for being here. Councillor Moise is the councillor for Ward 13 here in Toronto Centre. And he's been committed to issues of safety and transit and public health throughout his career. And prior to his political career, he was an addictions counselor at St. Michael's Hospital. So thank you very much for being with us here tonight. And I also want to welcome Gord Tanner to us there on the screen. So Gord, thank you so much for being here with us. So Gord Tanner is the general manager of Toronto Shelter and Support Services. So in that role, Gord oversees the city's emergency shelters, 24-hour respite and street outreach services. And he's dedicated his work to housing and homelessness with the city since 2005. So thank you, Gord, for being with us. I appreciate the fact that despite the fact that you're ill, you're joining us by Zoom. So thank you very much.
No, thanks for accommodating me.
So maybe what I'll do is just ask Councillor Moise and Gordon to just react to what you've just heard and perhaps say what you think was most striking or most informative from what you've just heard from Mandy.
Well, thank you, Mandy. I actually was quite impressed by your presentation and feeling hopeful. I wish Toronto was as forward-thinking in the sense that we are forward-thinking, but I'm happy that you've had many successes in Houston. I'm also chair of public health, and of course, housing is a social determinants of health. And we all want to house people in the city of Toronto. And we spend $1.7 billion a year in housing in the city of Toronto. We're the largest landlord in the entire country through TCHC, Toronto Community Housing. I mean, I could go on, but and we've used many strategies to house people in the city. of Toronto. We've had many successes. Yesterday, for example, I was with the mayor to cut a ribbon at Bond Place Hotel, 65 Dundas Street East. Yes, we were highly criticized for purchasing the building, and the cost for renovating was actually even much higher. But we're now housing 288 people in that facility, and directly from encampments to housing with wraparound services. And again, the key is wraparound services. We cannot house people, we cannot remove people from the parks and into housing because it will not work. You need the wraparound services. And so we have many community partners like Dixon Hall, Fred Victor, and many others that help us do that. And again, I don't know when you house those people in Houston, but fast forward 2024, there are many challenges in the city. Even during my time at St. Michael's Hospital, I see Dr. Howard is here. I was at the hospital when he was the CEO. But there are many challenges. We have a toxicity crisis here in the city of Toronto. We have the housing crisis in the city of Toronto. We have 500 refugees coming to the city of Toronto every month. And 53% of people in our shelters are refugees. So we have many competing issues, and we as a city have to deal with it all at once. Majority of the people that are homeless or underhoused are people who have addiction issues. And we know addiction is a healthcare issue. Many people have mental health issues. That's also a healthcare issue. But if the province isn't coming along to help us deal with these health issues, then the city, being the lowest hanging fruit, has to deal with it, because our residents, our neighbors are in our parks, and we have no option but to fill in the gap where the province has not. So that's where we are at. It's all hands on deck for us. It's a priority for council. It's a priority for the mayor. It's a priority to all of us as Torontonians to help those who are most marginalized. And so again, we're looking at best practices not only in Houston, but across the country and across the globe. I was actually at a Healthy Cities conference in Copenhagen about 3 to 4 weeks ago with Dr. Davila and Barbara Gray, who is our transportation general manager, to look at best practices in Copenhagen. And there are many lessons I've learned from that trip, and we have learned as a collective. And we've actually started to look at ways to actually improve things here and implement some of those strategies. But again, it's an evolving issue. It's a complex issue, and we need all hands on deck to deal with it, including our healthcare partners. And I work very closely with Dr. Rutledge on that as well. So again, it's all hands on deck.
It strikes me that there's a challenge in the model where you're saying creating an emergency rehousing system where all of our resources, or a large bulk of them, are going to just maintaining the shelter system. In Toronto, we're turning away hundreds of people every night and telling them there's no bed for them. So there's this mandate to build more shelters and have more shelter beds, but that takes away the resources we need to rehouse people. So how do we make that first step to break out of what is kind of a vicious cycle?
Yeah, it's a great question. And so for me, I go back to the math ultimately. So the reality is that if we could move half of those individuals out of shelter, we can free up beds. We can, in essence, double our shelter capacity. So the idea that we would take resources and build more shelter beds when we could take those same resources and move individuals out, we're going to be able to accomplish the same goal. We're going to be able to move that same number into those emergency shelter beds. But now we've actually produced remedy for a portion of those individuals. So, I know the devil is always in the details there, on what you can actually do with each of those resources. But I wonder if the mandate here isn't actually to serve more people, right? Rather than a mandate being to expand shelter, right? Because at the end of the day, we can make a shelter bed serve 2 times the number of people if we just could move individuals out of those beds. And so for me, that's the way I tend to approach this type of solution is how do I use the assets that we've already invested in to their maximum capacity? And instead of investing in more resources, more assets to be equally as inefficient, right? And to be as kind of costly and burdensome long-term and without providing the remedy that we're looking for. And that isn't meant to be a glaring critique on shelter. It is an easy cycle that we can find ourselves in. And I think the ability to just break loose from that and activate your provider network and build those rehousing muscles. And it sounds like you already have. So it's just really putting them to good use, right? Really targeting all of these resources to produce a different result and being able to maximize the use of your existing assets. You could accomplish the same thing, I think, that way.
Thanks. Gord, please go ahead. What are your thoughts?
Yeah, well, listen, first off, thank you so much to the Odette family and for putting on this very important topic tonight. And thank you so much, Mandy, for your thoughts. Several things come to mind based on what you said. And we here are actually experiencing, what you've portrayed. We have a shelter system that is growing, demand that continues to increase, and a shelter flow that is not where we'd like it to be. We'd like to be housing a lot more people with the supports they need to be successfully housed, than continuing to invest in emergency solutions. But I'd say we do have a history of successful housing first programs in this city. And so a couple of the ideas I really liked that you mentioned, I'll mention two. The first is, thinking about how we can be more flexible to buy our way into the market, if you will, to make more units available to people that need them. So whether that's looking at a new apartment block that's been, developed and leasing the whole thing, or really deepening our relationships with private market landlords and investing in a unit search team, actually with that real estate background and skills to find those units and source them for us. The second piece is this idea of getting everyone, the public generally, who I don't know how informed they are about the work that we're doing, but are seeing more visible homelessness on our transit system and in our parks and on the street, and the private sector, and trying to have that collective impact of everyone buying into a vision that is focused on getting people housed as quickly as possible with supports that they need to be successful, and communicating that effectively with the results that we achieve. So I think there's some pieces there for us to reflect on here in Toronto, and amongst, I'm sure, the many folks you have in the audience that deal with these issues on a daily basis here in Toronto.
Building on what both Mandy and Gord have said, there is, and this is actually a question that we received, many people are increasingly concerned about people experiencing homelessness living in encampments or sheltering on our transit system. And would you recommend focusing specifically these approaches on those individuals in an effort to demonstrate to the public that these approaches can work? And I'd invite anyone to respond to that.
I mean, I can use my lens as a city councilor in regards to creating more housing. For example, for every development that we build in the city, for every development that we build, for example, we get 4% of the total value of the building. We call it community benefits charges. And for me as a local councilor, I have actually invest those monies back into units, saying that instead of giving the city or myself as a representative $4 or $5 million, take that money and we will take the units instead, And so we have more affordable housing right there for our residents who need it. So that's what for 40 years or so. That's one of the things that we do. But I also want to add to the piece that I think that's really important as well is that we have to look at some of the traumas that people have that are homeless. For example, indigenous people, for example, they have their own trauma from residential schools. And so they are either themselves were in the system or they are children of people from residential schools. And so there's trauma there. And as a result of that, they're on the street. So we actually have to look more closely into who's there and why they're there. For example, we know that about 50% of people who are homeless are people of color, right? And one of the things we talk about at the city is creating space specifically for people who are indigenous or Black or women or whatever, because they don't want to enter, let's say, not only the shelter system, but also even moving into housing per se, because they don't feel safe in those spaces. So we have to micro target and look and see where people are at and how we can help them as individuals and as a city.
I mean, certainly my experience has been when there's a pain point, I'm motivated to solve for that pain point, because when I can solve for that pain point, I then have more leverage and influence to move us toward the full transformation that I'm so interested in. So if that is a particular pain point, I think it's worth at least exploring how could we target some of those rehousing activities that are already underway? How could we target them in more specific ways to create the relief that everyone is looking for so that they can see and feel and touch and experience the incredible work that the homeless response sector does day in and day out. So much of that feels so invisible to the general public. So the more that we can bring that service system directly to a pain point that is highly visible in a community, I think that only kind of clears more of the runway for us to keep moving and keep going. And I would hope offers some nice kind of wins for elected officials in particular, because I know the pressure, having been inside a mayor's office, the pressure that it comes, from this issue is incredible. So the more that we can be thoughtful in showcasing that the work that we're doing is moving the needle, even if incrementally, my experience is that tends to go a long way in helping to build the momentum we need to keep going.
I don't know if Gord, you wanted to say something, or I just want to, if you have anything, just please speak up. I was going to ask, given your emphasis on systemic approaches, that this can't be just, it has to be the whole system working together. I wondered if we could think here in Toronto, do we have the structures to allow us to create that kind of system change? I know that we have a group of really, I think, really skillful, well-intentioned, dedicated people working on this problem. And I guess the question is, could we change things for the better in how we organize the system?
I can start, Rory. There are many things we can do. For example, when council was reduced from 44 to 25, the work was overwhelming and still is, quite frankly. So we had to delegate our responsibility to staff. One of the things we delegated to staff was actually when it comes to building more affordable housing, that was something delegated to staff. So councillors themselves couldn't say, well, I don't want it in my ward, I don't want it here or there. And so I think taking that out of the hands of the councillors, I think has been beneficial. Because historically, for example, in my ward of Toronto Centre, 62% of social services have been in the downtown core in Toronto Centre. And so now that staff has taken that responsibility over, we see that there's more affordable housing being built in Scarborough, Etobicoke, North York, and elsewhere around the city, which I think is great. we know that historically people are more successful when it comes to recovery if they are in their own communities. One of the things I was impressed with in Copenhagen was that they do have social housing, the equivalent of our social housing there in Copenhagen, in that they house people, but after 5 years of being in social housing, then they transition to co-op housing. So, which is, I think, quite unique and helps them that way. One of the things I'm not quite sure that works here in Toronto, it may not know, I don't know. I don't sit on TCAC board, but for example, one of the issues we have, I find, is that there's intergenerational people living in TCHC. So, for example, if you are a child and you're 16 years old, once you turn 16, you could sign the lease, and then you can stay there, for as long as you want. And then, as you when you have children, then it continues and continues. So there's not a pathway to actually get out of the system, which I think that that's where there's a bottleneck in the system right now, in that there's a 15 to 20 year wait to actually get into TCHC. So I think we have to be creative in a way to help people transition out of TCHC so that we could actually get more people in housing permanently.
And if I could, Stephen, I'd say, to add, systems level thinking is essential for this complex issue. Here in Toronto, we do have a coordinated access system, which really is an approach that looks at all the number of people who are homeless in the city and identifies those individuals working with the funnel analogy at the other end of the funnel, let's say, who are chronically homeless, and matches them to supportive housing units or social housing units in the city. And that's been an approach, mandated by our federal government, but in place for the last couple of years. It's showing success, but I think we actually have to come at it at both ends, if you will. And so what are we doing on the prevention side to stop people from entering homelessness in the first place? What are we doing, as Mandy suggests, to rapidly rehouse people or trying to tap into their own skills and resources when they come into the shelter system initially to get them back into housing as quickly as possible? And I think that, that will require some flexibility and different thinking. And I think Toronto is ripe for that kind of thinking. So continuing the coordinated access side, which does look and distribute scarce housing resources to individuals through an equity lens, ensuring that folks who are Indigenous, women fleeing violence, youth, other racialized communities, or 2S LGBT individuals are getting access to housing supports in a fair and effective way, but also doing something on the preventative side in ensuring that people aren't entering the shelter system in the first place.
I just want to just second, that statement and appreciate how exciting a coordinated access system can be to afford us the opportunity to experiment and to figure out that spectrum of care that can be provided. And I can say in Houston, we started with a coordinated access system very similar to what you're describing, where you assessed everyone at the front end. We created a prioritized list. And there were certainly interesting experiences where we spent tons of man hours running around trying to find the individual at the top of the list. And meanwhile, that rehousing resource is sitting vacant. And all of that afforded us this opportunity to really push the limits of our coordinated access system and ultimately coordinated entry system and start to think we need a whole spectrum of resources to intervene. And so, adapted those triage tools to kind of bucket individuals into those interventions. And then the latest iteration has been, wait, everybody needs rehousing. And we're not always very good at knowing immediately who needs permanent supportive housing as opposed to a more time-limited subsidy. And so we can make 12 months of permanent supportive housing work for an individual on a time-limited basis. And so we don't have to wait for that perfect permanent supportive housing unit to be available. We were like, if we have rapid rehousing resources, let's move them in. And then we'll reassess them from within that environment and determine whether or not they actually need permanent supportive housing. And then at the end of those 12 months, we'll move them to that permanent supportive housing if that's what's right for them. But what we found is that a large number of individuals actually can stabilize within that period of time. It doesn't necessarily mean they're going to be in that exact unit, right? But we're able to figure out what's the right next step for them. And it doesn't always have to be permanent supportive housing. So I offer that as a potential future state for you as you're thinking about this, because I do think the system affords you the opportunity to really push the boundaries, right? Because now you have a standardized way to do that together, rather than letting it be another constraint, another rigid structure that we implemented. So I'm super excited for you. Yeah.
Gord, did you want to say something?
No, just nodding. I think that's great, and that issue of continuing to push the boundaries, keep thinking, rethinking what we're doing, and the last thing we want to do is have vacant units of supportive housing waiting for the perfect match.
Actually, one of the questions from the audience was for the two of you, Gordon, Chris, is what would be most, what if you could pick one strategy or thing about the current system that's most in need of change, what would you say it is?
Maybe Gord can start.
Yeah, well, let's think. What one thing? We spend a lot of time thinking that other levels of government need to come to the table, and the good news is just in the last year or so they have started to come to the table, both from the federal government, big investments to support refugees and newcomers arriving in Toronto that are in need of housing and shelter, but also in just recently on funding for encampments, and the province also in terms of the New Deal funding has come to the table. I think now is the opportunity to look at those resources and reimagine how they can be utilized to get better outcomes for the people that are experiencing homelessness and at risk in our city. And so I guess what I'd say is I'm a little bit excited about the opportune time we find ourselves in to reimagine and continuing to ask question around, how can we best utilize these resources in the public good to support people who are some of the most vulnerable people in our city.
Well, as a politician, one of the things I think, if we had 1% of the sales tax, we could do so much with it and build more affordable housing for people, among other things, more transit and build our infrastructure. We've asked many times and we'll continue to ask because we know that we can make a difference with that. One of the things though, that you mentioned in your presentation was preventing homelessness in the first place, right? And we've had strategies and policies in place at the city around demo evictions. In my ward of Toronto Centre, for example, 78% of people in the ward are renters. And many people are scared because, they are in danger of demo eviction in that a developer may tear down the building and build a condo. And these people feel very vulnerable. And so we've put policy in place in that when there's a demo eviction taking place, people are supported. They are given a rent gap payment, and they're also given funds to move to a new location and to return. And also too, the city is set in zones, and the downtown core is zone 1, which means that it's the most expensive place to live. And so we take the average rent of a renter and also including condos, and we allocate funds, one lump payment to the person that's being evicted. So, for example, they could get up to about $60,000 for one bedroom. But that's just for rent gap only. And so we've been very successful. As a counselor for the last 2 years, I've actually pushed the boundaries on that. And we've been very successful in actually making sure that people have those funds. And when they do come back, their rent is the same as when they left 3 years earlier. So those are some of the strategies where we have implemented at the city, and it's been very successful. And we will continue to push the boundaries that way, because preventing homelessness in the first place is so very important.
We're approaching the end of our time together, so I'm going to offer the last words to you, Mandy.
Oh, well, I have so many things to say. I think the words of advice that I would offer any community that I'm participating in is just not to hold back, right, on reimagining what's possible for your city, and also not get yourself too constrained by the perfection that we all seek. And I think on this particular issue, as has been identified, there are a lot of individuals who are overrepresented, who are experiencing these kind of extreme forms of poverty and health disparities. And what I lean on in that moment is this idea of abundance, this idea that if we can build a rehousing system that works for everyone, right, that we've now eliminated kind of one rung, right, of that level of disparity. It's gone. And we can push all of our resources and our activities upward, right, to grow the amount of resource now that's available to serve, right, a wider swath of individuals. Because at the end of the day, this game of having to choose among vulnerable people, right, among individuals who are overrepresented, that game is just not winnable. It's not, right? And so what we need to do is seek abundance, because that's the promised land. That's how we get to the place where everyone, right, is serviced. And then we start to eliminate those disparities in our community, which I think is the ultimate value and the ultimate goal. But again, sometimes we can get in our own way in pursuit of that, and it actually holds us back, right? And in some cases, it does harm. So my advice would be, hold that in your heart as you leave today. And I challenge you to go out and, push a boundary, think differently, question something, thoughtfully disrupt.
So the goal of tonight's lecture and panel discussion was to stimulate discussion and push us towards action to really make progress on this issue. I think we can all agree that it's been a great discussion, and I hope that we continue this conversation in a way that allows us to make change and achieve the vision that we all seek. So I just want you to, again, thank our speakers tonight. So Mandy Chapman Semple, Councillor Chris Moise, and Gordon Tanner, thank you so much for being with us. Let's just give them a round of applause again. Thank you. And now I'd like to just invite Lou Odette to come forward and share his thoughts and closing remarks. But before I hand the mic over, I do want to thank Lou and the Odette family for challenging us to use this lecture to really seek solutions rather than just managing the problem of homelessness. And I just also want to thank your family's longstanding, generous support for the work that we're doing to address homelessness in our city. So thank you.
Thank you, Stephen. My name is Lou Odette. I head up the P&L Odette Foundation along with my three siblings here in Toronto. And our father died in 2011, and a couple years after that, after we realized that he had spent the last several years of his life working to address homelessness in Toronto, we approached St. Mike's and with the proposition that we would recognize that by funding an annual lecture on homelessness with speakers from Canada and from around the world, speakers distinguished by having articulated a vision to ameliorate and even eliminate homelessness and who had taken direct and concrete steps towards doing exactly that. And I think the idea was that if we had a set of examples in front of us, that might motivate us in Toronto to develop a vision of our own to address the homelessness in this city. So many thanks to Mandy Chapman Semple for coming up from Houston to visit with us tonight and to share her vision and her experience and the steps that she took, concrete steps to realize that vision in many cities in the U.S. I'd also like to thank Councillor Moisey and Gord, Gord, for engaging with the topic here tonight and for all that you've done to try to improve things in this city for everyone and for the homeless people. I'd like to thank Stephen for moderating tonight and for the sensitivity and compassion that you bring to your work with the MAP Center for Urban Health Solutions in Toronto. So thank you, Stephen, very much. I'd also like to thank our audience, both the audience that's viewing remotely and the audience here tonight, for investing your time with us this evening. And so thank you very much for that. And the audience that's here, we do have a we have a reception afterwards just outside. So if you'd like to spend a couple more minutes, I hope you will stay here with us and wrap up the evening that way. So thanks again and good night.